So in this final screencast, we're going to talk about vascular tumors. And the two vascular tumors we're going to talk about are Kaposi sarcoma and Angiosarcoma. Kaposi sarcoma is an angioproliferative disorder that needs human herpes virus 8, or HHV8, in order to initiate. Other cofactors are necessary, but really without HHV8, Kaposi sarcoma doesn't form. And epidemiology is broken into four classic groups. The first group is the classic type, which is typically found in elderly Mediterranean men. The endemic type, which is found in children in Africa. Transplant-associated Kaposi sarcoma, which is associated with patients who are immunosuppressed and are post-transplant. And finally, epidemic Kaposi sarcoma, associated with patients with AIDS. Here's an example of the morphology of Kaposi sarcoma. It's got these erythematous plaques on sort of gross examination. And looking microscopically, you see these spindle-shaped cells, and if you were to do molecular markers on them, you would find vascular and lymphatic endothelial markers. These cells are initially polyclonal, and as they proliferate and the tumor sort of matures, eventually they become monoclonal. The treatment of Kaposi sarcoma isn't clear. Well, what is clear is that for patients who have HIV and Kaposi sarcoma, treatment with highly active antiretroviral therapy, or HAART, is highly effective. In other settings, the proper therapy is less clear, but that a lot of different therapies seem to have efficacy. For example, chemotherapy such as doxorubicin, immunomodulators such as interferon alpha, surgery, and radiation therapy have been employed with some success. However, there is no specific treatment to HHV8 itself. So that's Kaposi sarcoma, and now we're going to talk about angiosarcoma, which is a highly malignant form of tumor with a 5-year survival of approximately 35%. It's a soft tissue sarcoma characterized by pleomorphic endothelial cells. Early tumors may have sinusoids, sort of rudimentary vascular type structures, and these typically stain positive for CD31, which is an endothelial cell marker. There are a couple classic associations of angiosarcoma to know about. One is lymphedema, so for example, a patient who is post-mastectomy, and that's what's shown here on the right, angiosarcoma in a patient who's had mastectomy and associated lymphedema. Vinyl chloride, this is less common but still may show up on your boards. It's a compound that's used in polyvinyl chloride or PVC manufacture. Arsenic and thorotrast, which is an old type of contrast for X-ray studies. The treatment of angiosarcoma is definitely excision plus or minus radiation and chemotherapy. So that closes this screencast and all the lecture material that we're going to be talking about. And in class, we're going to reinforce these broad, diverse diseases with some problems and cases. Thank you very much.